ஒரு இன்சைட் எப்படி நடந்துட்டு இருக்கு, இப்ப என்ன நடக்குது, நம்ம என்ன பண்ணலான்னு. அதே மாதிரி நம்ம சித்த மருத்துவம் உங்களுக்கு தெரியும் எவ்வளவு பழமையான ஒரு மருத்துவம். அதுல என்னென்ன ஆப்ஷன்ஸ் இருக்கு, தற்காப்புக்கு ப்ரிவென்ஷனுக்கு என்னென்ன ஆப்ஷன்ஸ் இருக்கு, அதை பத்தி தான் நம்ம டிஸ்கஸ் பண்ண போறோம். அதே மாதிரி இப்ப லேட்டஸ்டா என்ன நடந்துட்டு இருக்கு நம்ம ஊர்ல இந்தியால, என்னென்ன தடுப்பு முறைகள்லாம் அவங்க கையாண்டுட்டு இருக்காங்க, இங்க என்ன பண்ண முடியும், யூஎஸ்ல என்ன பண்ணலாம் அப்படின்ற ஒரு சஜஷன் தான். இட்ஸ் நாட் அ ட்ரீட்மெண்ட் பிளான். ஸோ நீங்க உங்க லா என்ஃபோர்ஸ்மெண்ட் அஃபீஷியல்ஸ் உங்க ஊர்ல சொன்னதை நீங்க தயவுசெய்து கடைபிடிங்க. சோஷியல் டிஸ்டன்சிங் இட்ஸ் வெரி இம்பார்ட்டன்ட், அண்ட் ப்ளீஸ் ஃபாலோ த கைட்லைன்ஸ் பை சிடிசி. Thank you all. Now I'm requesting Thiru Sivasailam to conduct the next meeting, to start the meeting. Nandri.
Good morning, everyone, and thank you, Chandamarai. And again, we had such an overwhelming response on Thursday, and we decided to hold, and we were limited to 100 participants. So today we are not limited. I think we can go up to 300. Right now, I think we are 124. And Chandamarai already talked about talked about the disclaimer, and then this meeting basically was arranged because of the situation right now. Just to give a quick background on Global Center for Siddha Medicine and Research, we had a group of volunteers that has been practicing some of the traditional way of well-being, and then as it's mentioned here, and we have had anecdotal as well as personal experience in improving our health by following some of these methods. And in order to take it to the wider audience, we thought we need to do it systematically, as well as basically do research where it can be scientifically proved these practices as well as these medicines work. And that was the main goal when we started this organization. And it's been about a year old since we started, and we already have we approached Manipal Academy of Higher Education, and we signed an MOU, and they have started an integrative medicine center at Melaka Manipal Medical College. And one of the other things is through their help also, we were able to get official acceptance of Siddha treatment in Karnataka. And some of the future activities that we are planning is monthly video meetings on health topics. In the near future, it might continue to be COVID-19, but hopefully as we go further along, we will do other wellness meetings. And we are also planning on holding wellness camps in various cities during fall 2020. This is with the hope everything will settle down by then, by fall 2020. Today's program, we have lined up 4 speakers. The first speaker would be Dr. Shamla Kalyan. She's from University of Madras medical graduate, and then she has a MD in infectious disease from the US. And right now she's practicing at Mercy Medical Center in Oakland, Michigan, which is a Detroit suburb. And Thursday she couldn't join us because she was busy treating patients. So she'll be followed by Dr. Sundaresan. He's from Sri Lanka. He's a MD, trained in Australia, and he was also Dean of the Eastern Medical College in Sri Lanka. This will be followed by 2 Siddha doctors from India, Dr. Arul Amudan, which he's Assistant Professor of Pharmacology at Melaka Manipal Medical College in Karnataka, and Dr. Selva Shanmugam, who is a MD PhD in Siddha medicine, and he practices integrative medicine with allopathy doctors in Chennai under the auspices of Health India Foundation. before I leave, as we said, I mean, the disclaimer is very important. Everything we give here is not the final treatment, but you have to work with your local medical doctor or health professionals if you have show any symptoms or if you want more information. This is a slide I just wanted to show. I had similar slide from Thursday. It's as of yesterday, we are at 680,000 cases worldwide, and the US is number one with 124,000 almost. And on the right side, it's a map showing like deaths from malaria infections worldwide, and the bottom is the COVID. And from the map, you can see wherever there was a lot of malaria infections and deaths, COVID, the impact of COVID-19 has not been as great.
Sorry to interrupt.
And
they're not able to see the slides.
Oh, you cannot see the slide?
Yes, the part is.
Okay, let me see.
The slides.
Okay. Can you see the slides now?
Yes.
Yeah. Okay. Okay. Thank you. Yeah. So the left part of the slide is the COVID status around the world, and then the right part is a map of malaria infected areas. The top is malaria infected and death, a large number of deaths in the world. And then the bottom one is the COVID-19. And you can see from the contrast of the map how malaria infected areas haven't seen. I mean, there is still cases of COVID-19, but it varies. It's exactly opposite, diametrically opposite. I'm not a medical doctor, but this is just a thought for your thing. Again, I want to thank all the speakers in spite of their busy time to come here and educate us. And then also at the end of this 4 speakers, we'll open it up. We have a number of questions we have already raised, already been sent to us. We will handle them first, and then if time permits, we will open it up for from the audience too. With that, let me turn it over to Dr. Kalyan. So.
She's muted. She's still on mute, Sivasar.
Yeah, let's see if Dr. Saravanan can unmute her. Can you unmute yourself, Dr. Kalyan? Yeah, she did. Okay, go ahead.
Yeah. Good morning, everyone. எல்லாருக்குமே ரொம்ப நன்றி எனக்கு இந்த சான்ஸ் கொடுத்ததுக்கு. நான் எந்த ப்ரிப்பரேஷனும் பண்ணல. Shankari was என்னோட college mate. A week ago, we had a discussion amongst us, and based on that, she wanted me to give the same presentation, and that's what I'm going to do. I have not timed myself. I have not made any slides or preparation. So please pardon me if I'm taking a little bit more time or a little bit less time. Having said that, I'm going to speak in English for the most part because I think it will be easy to understand because it's more science. But India, the Tamil analogy use panana, I will try to use that. I want to make this simple and at the same time scientific for all our audience. And I'm only going to speak the allopathic part of it because I don't know anything about Siddha. Today I'm going to learn more about that with all the esteemed other speakers who are going to follow me. So, as we all know, this virus originated in China. No doubt about that. As far as infectious disease goes, we have bacteria, we have virus, we have fungi, we have parasites, for the most part. Usually, 85% of infectious disease is bacteria. In the virus, fungi, but now suddenly, the viruses have taken a board, and now we are talking all about this COVID virus. As far as viruses go, most of the infections are self-limiting. That is why we don't talk about them. We get an infection, it comes, it goes, we don't even know we had it. I had the common cold. I had the GI virus. That's how we talk about viruses. But this one has really taken upon our lives, both physically and economically, spiritually, and all other aspects. Why is that? So I'm not going to give a presentation that's scientific. I'm going to take you through the life of the virus. That way we'll understand what we are going through. I think that's a much easier way to understand. Viruses, unlike bacteria, fungi, or parasites, they don't have a life on their own. We call them viral particles. We don't call bacteria bacterial particle. Only virus, we call it's a particle. Basically, it is living, but it cannot grow. We call viral growth replication. We don't call bacterial replication. Each word has a connotation and a meaning to it. So when there is a virus particle on the floor or on your couch, it has no value. It cannot multiply. It is live, it is there, but it cannot do anything to you. Only when it gets into your body, and even that only to specific areas, it can multiply and grow and cause disease. The chinna example solnaka, if there is a GI virus and say it gets into your nostrils, into your nose, it does nothing to you because it does not have the ability to multiply in your nose. It has to get to the GI system, stomach, anga poi multiply anada, it can cause diarrhea. So it has to get to that specific area to be able to cause disease. So how did this virus start? As anyone's guess, someone says it came from an animal, it came from a reptile, it came from somewhere. We have viruses are three types. One is what's called an RNA virus, one is called a DNA virus, and HIV. HIV is very unique because it is an RNA virus that becomes DNA and then turns RNA again. So adanalda we are not able to find a vaccine because it's constantly tricking us. Why did I mention HIV? Because this virus, which is COVID virus, which is a coronavirus, corona is a family, and the family la nariya viruses irukku, rhinovirus irukku, nariya viruses irukku. They all are only known to cause the common cold or affect our upper respiratory tract. What is upper respiratory tract? Our nose, our pharynx, anything that stops above is called the upper respiratory tract. The minute it goes down to the lungs, it is the lower respiratory tract. All the coronaviruses that we know so far are majority causing only upper respiratory tract infection. This is one of the most important ones that is also causing a lower respiratory tract infection, and that is the cause of majority of deaths we are seeing. So what is unique about this virus? In my opinion, the unique nature, which many scientific organizations, even in the USA, are denying, the particles are very, very small. I told you it's called a viral particle. The viral particle is 0.3 micron meter or less. So when it is that small, and if the air is humid, it sticks in the air. It stays in the air for a long time. This particular statement that I'm making is very, very important. This is what determines social distancing, transmission, don't go near a patient who's coughing. Everything is dependent on the size of the particle and what kind of atmosphere you're living in. So if there's a virus particle that is in the air and there's a person who's coughing, that person maybe not have any symptoms. But the next person who gets that particle from the air, breathes it into his nose, in the nose. I'm taking you through a movie. So I just want you to understand how the virus behaves. And if you can imagine this as a movie, it's much easier to understand. So this virus particle that is in the air is getting into a person's nose. in the nose, we have what is called cilia, C-I-L-I-A. You don't see it. It is not the nose hair that is cilia. Cilia is in the skin of the nose. So that the cilia, the virus attaches to that cilia. Now, this is the most important part. This is like a hero and a villain in a movie. So if you have more heroes, you'll be able to get rid of the villain faster. If you have more villains, the hero can still not win. So what I mean by that is, if you have a high viral burden, say the person who coughed and left the room, or the person you're talking to has a cough with a very large amount of viral particles, and you are inhaling it, if you are a healthy person, it still attaches to your cilia. It is going to do what it's going to do. But your body has very good defense. You're a very healthy person. So your defense is going to come into action. I don't want to go into the details, but this is called T cell immunity. For viruses and fungi, the defense is via what's called a T cell immunity. So if a person has good immunity, these virus particles will, so the virus particles will fight, our body will fight those virus particles. So what you may get in that situation is only sniffles. So you'll get the sniffles which you cough or sneeze, sorry, not cough, you only sneeze, and you may have a small amount of nasal secretion which go away. You may get a small headache which will go away. This is a self-limiting condition at that point. But what happens in this process is the cilia is all used up. Cilia will regrow and regenerate. So if you have good immune system, that regeneration will go fast, and you will not even know you had a viral infection, and you get better and you continue with your life. But for some reason, if your immunity is low, or you have diabetes or whatever the conditions are, then your cilia is not, because they have a specific receptor in the lungs which likes these viral particles to attach. And their infection is much more worse than younger people or people who do not have diabetes. So that's why they have to be more careful. I'm going to stop here, and if there's any questions, please ask. So the one more thing I'm going to say, the difference between flu and coronavirus. Yes, flu has taken many lives that we know, but the transmission of flu is not as worse as the coronavirus. That's number one. Number two, the infection that's caused by flu is over a period of years, a period of months, whereas this COVID has so much virulence, which means it's more toxic and can cause disease in 2 to 3 months. So the particles are much smaller and they have more virulence as compared to the flu. And that is why we see so many deaths with the flu, with the COVID virus as compared to the flu. If the COVID virus sticks with us every year, definitely the loss from COVID virus will be much more as compared to the flu, but hopefully we'll find a vaccine before that. Thank you.
Tamara, this is Saravanan. I think people are asking a couple of things. One, there are no screen. I haven't shared any screen because of this hacking part.
Sure.
So when slides come, it will show. The second thing is a lot of people want to know whether Tamil or English, but it looks like I'm getting messages saying that to keep it in English, we'll keep it in English.
Okay.
The third is like people want to chat with each other, but I kind of disabled it and said they can chat only with me at this time.
Mm-hmm.
But if it want to be open to everybody, I can open it. But again, I'm not sure who is in the group and what they will chat. So we will be taking a risk if we open it to everybody, because anybody can chat. So probably the best thing would be to send the question to me, to the host, and then I will ask the question to whoever the panelists are. And that way I think we can keep it a little safer, because we really don't know who's in the group. And think the other thing is I might remove the names in case if there is any there's no name or anything attached to it and things like that. So for now, what we can do is like, if you have any specific question for Dr. Kalyan, we can do it for like next 5 minutes. I'll just take question and answer for Dr. Kalyan. If not, the next thing we'll ask Dr. Arul to talk, and then Dr. Selva to talk, and Dr. Sundaresan. Is Dr. Sundaresan here, joined back from Sri Lanka? He may be on mute, but Dr. Sundaresan, if you could, I don't think he joined back from Sri Lanka. Yes, I think he's there, so I'm going to unmute him. Dr. Sundaresan, you're there, right?
I'm here.
Okay, I'll unmute you. So this next 5 minutes, I think this is 11:25 till 11:30. I'm going to take audience's question on the chat and then pass it on to Dr. Kalyan. So I have a question from Prakash, and let me see. He say between joining the session, I missed the part about dry cough and how upper respiratory symptoms translate to lower respiratory infection. Can the doctor please let us know what to watch out for? Dr. Kalyan?
Sure. So that was the part that we had before this interruption. So I said the viruses enter through the nose. They get attached to what we call the cilia on the nose, and the body tries to fight the infection. And in that process, the cilia dies. When the cilia dies, there is no more protection. So the viruses now will enter into the pharynx. So when you have the infection only in the nose, you'll have the sniffles. You'll just have the sneezing. But once the infection passes that and gets into the pharynx, into our throat, then you start getting a dry cough. The reason the cough is dry is because viruses generally are not capable of producing sputum because they have only certain things that they can do. So based on their properties, the cough that you have is a dry cough. It's never a cough that causes sputum, but now later on it can produce sputum. That's a different reason altogether. I hope I answered his question.
Okay.
Can I ask a question? I'm Dr. Sundaresan.
Yes, Dr. Sundaresan, please.
Yeah. Now, doctor, you said that there is a cytokine storm, and that leads to, I think, ARDS and other effects in the lung. Now, hemophagocytic syndrome, I have some experience treating dengue patient with hemophagocytic syndrome. Same thing happened there, cytokine storm. So I, of course, treated, and it has been treated early also with steroid and immunoglobulin with very success. One patient, we had a patient with multi-organ failure, almost die, but we gave steroid and immunoglobulin, confirmed hemophagocytic syndrome, and he recovered. So I'm sure people have tried here also with steroid. Is it same? And any idea about the response?
Yes. So when you talk about dengue fever, SARS, not even SARS, Ebola, Marburg, for some reason, they are hemorrhagic syndromes. So it depends upon where the virus attaches, like I told you earlier. Here, it attaches to the respiratory epithelium only. So they did try steroids for SARS-1. When we had the Zika and the SARS, they tried steroids, and actually it had a counter effect. It was not like it was neutral, it actually caused more problems. So based on their SARS information and SARS knowledge, this is called SARS-2, by the way. So now they came back and says, since it was not useful, in fact, it was detrimental with SARS-1, they don't even want to try it with SARS-2. Now, point number one. Point number two, ARDS has two phases. Initial one is a proliferative phase, and the next one is a regenerative phase. Now we are using steroids towards the second phase of ARDS. We still will not use it in the first phase, meaning we will not use it in the first week of ARDS. And the third point, as compared to hemophagocytic syndrome, where you have bone marrow depression, thrombocytopenia, bleeding, multi-organ, DIC. This doesn't do anything like that. All it affects is only the lungs. It does not affect, if you have renal failure, if you have other organ, multi-organ failure, that is more because of hypotension and hemodynamic instability. It has nothing to do with the virus itself. So that is what makes this very different from our hemorrhagic infections that we have with dengue and other infections. I hope I answered your question.
Thank you.
You're welcome.
Okay, I'm going to kind of, somebody asked about the food for immunity, but then Dr. Selva and Dr. Arun will address, so I'm going to leave that. And someone asked about the effect of salt water vinegar. Yogi asked about what's the effect of salt water vinegar on COVID-19?
Believe it or not, allopathy is looking for answers for all the problems, prevention and cure. This is an emerging illness. What that word means is we don't know what we are doing. So part of that is we are recommending salt water gargle in the initial stage when that sniffle that I talked to you about. If the person has sniffles or if he has a dry cough, we are asking people to do the salt water gargle with the hope that because the virus has a fat lipid layer on the outside. So that is why you wash your hands with soap and water, right? Obviously, you cannot gargle with soap water. So instead of that, they are saying use salt water gargle with the hope that it'll kill the virus. I don't know how far it's been successful, but that's one of our recommendations, yes.
Okay, and Shantini asked whether there is some protection when COVID enters through the eyes. So probably they're asking about protective measures for entering through the eyes, or is there any other protection or something that you have to do for preventing COVID from entering through the eyes?
Okay, so COVID has been found in every secretion in our body except the urine, and no one knows that. It's in your saliva, it's in your tears, it's everywhere. So the reason we wear goggles and close our eyes when we go to a patient's room is because when the patient coughs, it can get into your eyes, into your tears. But it does not cause conjunctivitis. It does not cause eye infection. The fact that it's there, and if you touch your eye and you touch your nose, you're going to get the infection. That is the idea behind wearing the goggles and protecting your eyes. It is present in the secretion, but it does not cause eye infection.
Sure. And there's an important question from Divya Nadia Selvam. It said, like, what kind of mask will help? Will kerchief prevent as well?
Okay, that's a very good question. So technically, if you are definitely near a COVID patient, it is going to be the N95 mask. I cannot emphasize this more. This is, CDC has different guidelines. They keep changing. If we don't have enough masks, we cannot down-regulate our requirements. But that's what they're doing. Without going there, I will tell you the right mask to wear if you're near an active COVID patient is an N95 mask. Now, if you're in the public, like I told you, it can be in the air, you can wear a kerchief, you can wear a normal surgical mask, you can wear something which is a partial protection. It is not a complete protection, but at least it will prevent some particles in the air which has the virus. It will prevent you from breathing some particles in the air that has the virus. Is it a complete protection? No. Is it some protection? Yes. But if you're an active COVID patient, if you're going near them, it has to be an N95.
Sure. And Jayabalan and Rama asked, like, it's a pollen season now, and many of us normally have the same symptoms that Dr. Klan explained. How do we differentiate that from this infection?
That's a very, very wonderful question. And having some clinical experience in the last month, I can tell you, the patients tell me the sniffles that they experience are very different from the usual sniffles. They are not able to describe very clearly, but they're saying it's usually one nostril more than the other. And they're saying they feel like irritable sneeze. I don't know how to explain this. It's like, பச்சை மிளகாய் எடுத்து மூக்கில் வச்சா அப்படி இருக்கும் அந்த மாதிரின்னு சொல்றாங்க. But I don't know, I haven't experienced it, thank God, but They say it's a very different sneeze that they're experiencing. And they say they can tell, I don't feel well. And virus can't do that to you. So it's not your usual sneeze. And whenever you have a sniffle and it's different from your pollen season or allergic or asthma sneeze, you should watch out.
And a lot of people ask about preventive measures, but that will be addressed soon.
Okay.
Maybe I'll take two more questions on this, and then we'll let Dr. Arul to come here. And there was some specific question about the personal health, which I'm not going to take at this time. And so I'm just looking at another question. So somebody asked about whether, how confident are we that the hot weather will make it better? And somebody replied from Florida saying it's already hot and it's spreading. So that's something that Dr. Kalyan, do you have any idea about whether the hot weather will make it any better or not?
Yes. So one of the virologists, I'm only borrowing her opinion because she's a virologist and she works in a lab. So what this is, I told you, it is in the air. So it is not about the viral particle in the air by itself is not effective. It doesn't do anything. Only when it gets into your body and gets into the right cells, the nose, the larynx, the lungs, it causes the cytopathic effect. So in the air, as long as the weather is not humid, it will fall on the ground, and if no one goes near, it will be okay. The infection can happen only when it enters a human body. Human body temperature is always the same, irrespective of whether you're in hot weather or cold weather. Am I right? You're always at 37.3 degrees. So hot weather or cold weather is not going to make a difference. But if it's a hot but dry weather, it's less likely for transmission as compared to a hot, humid weather. Hot, humid weather conditions in any place will still have the spread of the disease. So it's not the temperature that matters, it's the humidity that matters, or how long the virus lingers in the environment. But once it gets to your body, it's the same thing, doesn't matter where you are.
I think there are a lot of good questions too, so I'll keep going a couple of more minutes. And Dr. Sivasalam asked, what guidelines to enforce if you have been exposed to the COVID patient? Does the dose and duration of the exposure matter?
Okay, so again, CDCs keep changing the guidelines on this. For the public, they say if you're exposed to a person who has COVID, you should self-quarantine yourself for 14 days. Whereas if you're a healthcare worker, they say you have to come to work as long as you don't have any symptoms. So this is like an ironic explanation they have. Again, I don't want to go there. But in my opinion, I would say if you're exposed to a COVID positive patient, isolate yourself for 14 days. Watch for symptoms. If you have symptoms, get tested. That's what I would say. Right. That's for the safety of everybody.
Sure. And there is one other important question from Jay Kumar Tyagarajan. At what point or when to go to the hospital?
Very good question again. Do not go to the hospital because you are going to be infecting people going there. If your place where you live has drive-by testing, go there. When should you go there? When you have a dry cough that is paroxysmal. You're not able to control that cough. When you have a fever to any degree, right now, I would say 100 point, not me, it's a CDC guideline. If you have a temperature of 100.3 or above and you're a normal person, if you're a diabetic and age over 60, the temperature cutoff is 99.6. So if you have a temperature of 99.6 or above, and if you're 60 and have a diabetes, or if you're a normal person less than 60 and your temp is greater than 100.3, you have to get testing done. I would suggest don't go to the hospital, go to a drive-by testing to prevent transmission. When should you go to a hospital ER? When you feel short of breath. If you feel like I cannot get up and go to the bathroom without huffing and puffing, please go to the emergency room. Do not wait. Hello? Are you guys there?
Yeah.
Sorry, yes. Sorry, it's my fault. I was on mute. Kailash asks, how much will there be relapse? And if it is, how severe it would be?
This is an emerging illness. We don't have all the answers. As of the news that came yesterday, there is some illness in Wuhan again, but they are not that sick. But I'm not sure how it's going to play out.
And Pavitra asked, how about gloves? Should we wear gloves even if we go grocery shopping?
The choice will be to wash your hands more frequently rather than wearing gloves. You can wear gloves. There's nothing wrong with that. Right now, nothing is wrong. But even if you wear gloves, I would suggest come home and wash your hands with warm water and soap. Why? Like I told you, the virus has a lipid covering. Lipids always will die with water and soap. That's why even the Lysol, the sanitizers are not that great. But if you use warm water and soap, you can always kill that lipid. And when you kill the outer covering, the virus will die. So warm water and soap is much better. But if you want to wear gloves and go shopping and come back and wash your hands, that is fine.
On the same note, someone asked about buying vegetables and fruits and milk packets. Do we have to disinfect them?
No, you don't have to disinfect them. So somebody did a study on this and they said the virus lives longer in metal particles, rather than in organic stuff or on wood also. Even wood, it doesn't live that long. Again, I don't have any authenticity to the study, but someone mentioned that. So you don't have to disinfect your vegetables or fruits as long as you wash them. Warm water is your key. As long as you wash them with warm water, you should be good. And if you can peel the skin off wherever you can, do that. That's even better. I know skin has a lot of good nutrients, but for now, let's not eat that.
And one more question. How long does it take to show the first level of symptoms?
Very good question. So they are asking me what is the incubation period for the whole problem. It can go anywhere from 2 days to 14 days. That is why we say isolate yourself for 14 days when you get exposed. How is that 2 days to 14 days? It's a very long period. The reason they came up with that is it all depends upon the host and the amount of the viral burden that you are exposed to. So if the person has some kind of cancer, or the person has diabetes or other illnesses, or even rheumatoid arthritis, and they're taking all these medications which are immunomodulators, and if they get exposed to even a small amount of virus, they are going to get the infection much sooner than someone who's healthy and got exposed to that small amount of virus. On the other hand, if we have a very healthy person and that person gets exposed to a large amount of virus, that is why the frontline workers are a problem, right? Because we are getting exposed constantly from one patient to another to another. So when you get exposed to a large amount of virus, however healthy you are going to show symptoms sooner. So the 2 days to 14 days came from that, the whole thing. So the incubation period can be anywhere from 2 to 14, depending on how healthy you are and who you got exposed to.
Okay, I think there are more questions, but there are more speakers too. Thank you, Dr. Kalyan. So if you could just hang on, if you don't mind,
Sure, no
your
problem.
time.
No
Tamara, do you want to just bring in Arul next? Or? Dr. Sundaresh, do you want to go next?
Yeah. You want me to?
The thing is, do you have any slides at all? Because I disabled slide sharing.
Yeah, I do have slides.
Okay, let me see whether I can allow you to specifically do that or not. But do you want you to send do you want to send the slides to me so that I can show it, or how you want to do with it? Because I disabled screen sharing for everybody. Okay. But you have the slides with you, right, Dr. Sundaresan? I think I don't have your slides.
I do have.
But if I enable the screen share, then probably anybody can again share the screens, I think. So that's my understanding.
What can I do?
Ramraj, do you have anything about can specific speakers share their screens? Can you allow them to share their screens? Or is it possible to?
Okay. டாக்டர் சுந்தரேசன் நீங்க வந்து ஷேர் ஸ்கிரீன் போட்டு ரெக்வெஸ்ட் பண்ணுங்க, அவர் ஹோஸ்ட் வந்து அக்செப்ட் பண்ணிக்குவார்.
இப்ப requesting
நீங்க ஷேர் ஸ்கிரீன் உங்க பாட்டம் ஸ்கிரீன்ல ஒரு ஆரோ மார்க் இருக்கும், அப்வர்ட் ஆரோ மார்க். அதை வந்து கிளிக் பண்ணுங்க. இட் will ask a request to the host.
Yes, வந்தது. You cannot start screens while the other participant is sharing. So the message is
இப்போ வந்து ஷியாமலா கல்யாண் வந்து அவங்க டாக்டர் ஷியாமலா கல்யாணோட ஸ்கிரீன் ஷேர் ஆயிருக்கு. அவங்கள வந்து ஷேர் ஸ்கிரீனை ஸ்டாப் பண்ண சொல்லுங்க.
நீங்க டாக்டர் கல்யாண் நீங்க வேணா ஸ்கிரீன் ஷேர் பண்றது ஸ்டாப் பண்ணிடுறீங்களா?
எப்படி பண்றது?
Let me do one thing. I'll try to stop participants sharing. Maybe now, Dr. Sundaresan, can you request the share again to me now?
It's coming. Yeah, now I can.
Yeah.
No, it's okay. Start பண்ணலாமா?
I think Dr. Thamani, can you give an introduction about Dr. Sundaresan quickly, and then maybe Dr. Sundaresan himself can give the introduction quickly, right? I think then.
I'm a consultant physician from Sri Lanka. I'm also a senior lecturer in a medical faculty in the eastern province of Sri Lanka. So I'm not an expert. I'm not a microbiologist. I'm not a disease consultant, just like Dr. Mrs. Kalyan. She did a good job. But my topic is a little different. As I'm interested in Siddha and Ayurveda, so the topic is going to be, is Siddha medicine the solution for the present COVID-19 crisis? Can I start?
Yes.
So now, before that, I just want to, yesterday I read this, this information is really alarming. Now, as said, this particular COVID-19 virus, of course, it's a highly contagious virus. In average, it can infect more
Dr.
than...
Sundaresan, sorry, I'm interrupting. I think they're saying the voice is overall low. Is it possible to adjust your mic?
Can you hear me now? Is it okay?
I can hear you good. I'm just waiting for the audiences to say. They say it's better. It's good.
Okay.
Voice is cracking. Yeah, most of them are able to hear well. So probably getting close to the mic would be helpful.
I just now close to the mic.
Thank you.
So this particular virus, I'm sure Dr. Kalyan will accept me, agree with me, is highly contagious compared to the simple flu virus. In average, this virus spread more than 2 people. But if you come to flu, one person can spread to, in average, 1.3 people. So it's highly contagious. If we take in US, now when it comes to flu, up to 20% can catch flu in as per the statistics. That is, if you don't have vaccine for flu, of course, 40 to 60% may catch the flu. But when it comes to COVID-19, it is highly contagious and there's no vaccine. So as per the present scientific evidence says, so it is 70% more contagious than the flu. So they predict that in US, the prediction is, if it goes like this as per the present status, the 60% of the population can get affected. And out of the, altogether 26% of the population may need admission, but US has only 0.3. They can accommodate only 0.3% of the population. So you can see the magnitude of the problem. Now, when it comes to the treatment, of course, the allopathy medicine, at the moment, there are small studies favoring to treatment. Before that, how do you treat COVID-19? Either you should kill the virus or you should improve the immunity. Because as said earlier, if you see the death rate, it is the more death is among the people who have low immunity, like diabetes, heart disease, hypertension, and kidney disease. So when you have low immunity, the death rate is high, but younger people, the death rate is much lower. So if you have low immunity, the death rate may go up to 10% or more than 10%, even 14%. But in younger people, it is less than 1%. So our treatment should aim either you kill the antivirus or you improve the immunity. So far, there were small studies favoring the chloroquine, or the other form of chloroquine is hydroxychloroquine with azithromycin. Initially tried in China, then the small study from France came. And it's a small study, but actually the people who are on hydroxychloroquine and azithromycin, the virus, of course, leave the body quicker than those compared to the control. And there was a second option came recently, I think day before yesterday in JAMA. The second option is infusing the plasma of the patient who has been recovered from the COVID-19. So if you see the first study, the hydroxychloroquine and azithromycin study, of course, the control, there were 16 patients. In the treatment group, there were 20 patients, and all 20 got hydroxychloroquine. And out of the 20, 6 also got azithromycin. So if you see the response, the control study, the black, of course, in the day 0, all the control azithromycin and the azithromycin plus, the green line is chloroquine plus azithromycin. The blue line shows the patients who got chloroquine or hydroxychloroquine. So initially, 100% of all 3 groups have viruses in the pharynx. But with time, if you go by day 5, those who got hydroxychloroquine and azithromycin, 100% of them were cleared from viruses. But those who got chloroquine, nearly 60% got cleared out from viruses. And of course, control group, nearly 80% got still the viruses were there in the pharynx. So this was a small study. And I think US, Sri Lanka, I don't know about India, we all have started using hydroxychloroquine as a treatment in a particular group of patients. And the other study, of course, came, I think, day before yesterday in JAMA. They infuse the plasma of the people who have been recovered from COVID-19 and infuse to those who got a severe pneumonia or ARDS, a severe form of lung disease. And again, they tried with 5 people, critically ill people who were admitted in intensive care unit. And if you see the results, all 5 people, the viral load were improved with this particular plasma infusion, and hypoxemia improved in all 5 people. The organ failure, the indicators which of organ failure improved, and the temperature improved. So this is the second study. So some promising. These were the 2 important, small but promising studies. Meanwhile, if you come to Chinese medicine, the traditional Chinese medicine, they have done few studies on SARS in around 2007 and 5. And there were few studies, in vitro laboratory studies are going on with COVID-19. This study, of course, in 2005, more than 200 Chinese medicinal herb extracts were screened for antiviral activities against SARS. And they found that 4 herbal extracts and compound licorin and candidates for the development of new anti-SARS-CoV drug. So there were promising evidence here. The 4 herbal extracts have some activity against SARS virus, which was the right. And in 2007, they again did few studies on extracts of some of the herbal medicine, Chinese medicine. If you see, there were 4 different compounds which shows activity, which was inhibiting the SARS virus, which in 2002-3 we had the SARS virus. So it shows inhibition. It was inhibiting the SARS virus, as well as there are some cytotoxic effect on SARS virus.
Sundaresan?
Yeah.
So I'm just sorry being a moderator. I'm trying to kind of a little bit thing on it. If we can bring in Dr. Arul and then come back. Most of them are all not doctors on this thing. So maybe if we can just have this for the question and answer session about the studies.
Okay.
If we can just, because all of them are public, basically like 99% of this. So we can keep it very to the public part. And then when it comes for the studies part of it, the questions are coming on about the medicines. Maybe we can talk about it at that time if you don't mind.
Okay. So I think again, as the present COVID-19, there was a press conference by well-known Chinese respiratory specialist. He mentioned they have done some studies, 54 herbal herbs were in. They did a lab study on 54 herbs. Out of the 54 herbs, 4 were active against the particular COVID-19 virus. And another important things to note is that in the present COVID-19, nearly 85% of the people who has been infected with COVID-19 in China were using the herbal medicine. When it comes to the when it comes to the modern medicine, of course, what we do is we give medicine which acts against the viruses. But when it comes to the traditional medicine, of course, what we do is we help the body to improve the immunity. That's the difference between the modern medicine and Siddha medicine. There were several evidence with the South Indian herbs which show some activity against several other viruses. There were evidence to show the pepper, turmeric, tulasi, and neem, that is verpilai, has activity against some of the viruses. And again, people can understand, but I can shortly say the garlic, which is one of the anti-broad, one of the herb which has activity against many viruses, namely influenza virus, herpes simplex virus, and Coxsackie virus. So what I say is there are many herbs which shows antiviral property which acts against viruses. So I think probably I'll stop there because I want to share what is happening in the modern medicine and what can the traditional medicine or the Siddha medicine can do to the people who have been affected. So basically, what I say is we can't ignore the Siddha or Ayurvedic medicine, where what they do is they don't really treat against the viruses. What they do is they improve the body, they improve the immunity to fight against the viruses. There are a few other things I can share maybe later because I don't know if people can understand. I thought majority of them are doctors, so I'm sorry if I share little detailed scientific evidence. So we'll see how it goes. Probably I can discuss at the end about some of my understanding about Siddha medicine. Thank you.
Sure. Thanks, Dr. Sundaresh. What I'll do is I'm sure they'll have some questions about medicine specifically. So I'll take 5 questions if they have from the participants. And already had one question about the azithromycin and chloroquine being treated. What is the strong evidence for it? But I think you highlighted it. Yeah. And do you want to add anything about?
As I said, there's no strong evidence. Only the study was very small study, so we have to wait. There are some more studies are going on. We have to wait for the evidence, so we can't come to a conclusion at this moment.
Yes, I can add a little bit on that one. As being a cardiologist, like they are not what we call a common medication. They have really dangerous side effects too. So it has to be prescribed by a physician, and you should take it. Definitely not many people in India especially are taking it just because sometimes they can get it, but it has to be prescribed, and you need to understand because both of them together can cause life-threatening heart problems. So that's something to be aware of. And somebody says, Dr. Slide saying US 60% will get the virus. What's the basis of this data?
Actually, I can share the link. There was a nice article written by Dr. Deepak Chopra based on scientific evidence. Of course, these are not his assumption or my assumption. If you want, I can share. So as per that, he has given the evidence also as well. So he says, as per the present situation, 60% of the American may get COVID-19. I will share if I can share it.
Sure, we'll send them later. And the last question, Siddha claims are not scientifically reported. They do not tell where it failed and why. Please, someone can answer. Probably it's like a very generic question. We'll come back. Probably a lot of people are asking about the preventive part of it. So we'll get Dr. Arul and Dr. Selva, who will give the Siddha aspect, and that will answer this question too from Selvan about Siddha claims are not scientifically reported. So Dr. Arul, are you on? I think he may be on mute. I'm going to unmute Arul for a minute, and then he should be on. Are you on, Arul?
Hello, good morning. Can you, yes, I am on. Can you enable the screen sharing option?
Yeah, so I'm going to, if Dr. Sundaresan can stop his
yeah, I will.
sharing. I can hear that too. Like, yeah, Dr. Arul's. Okay, Dr. Arul's back on. Here, Dr. Arul, you're on.
Yes, yes.
Now they can see your slides.
Very good morning to the GCSMR organizers, other speakers, and the participants of this talk. So basically, I am myself Dr. Arul Amudan, and I am working in Manipal University. So with the help of GCSMR, we are establishing the Advanced Research Center for Siddha in Manipal. And the MOU was made already, and we have started a few of the projects already. And next, we are focused on the corona infection area in the Siddha medicine. So quickly, I will go to my presentation. I have only a few slides. So in layman language, I will present for you. what happened after the virus, first the virus is in the atmosphere, and when it comes to contact with us, first it enters through the upper respiratory tract. That all well explained by the previous speaker, madam. And then it goes to the lower respiratory lung. There it releases a lot of inflammatory chemicals in the lung that leads to lung damage. So here the Siddha has a lot of role in this area, preventing or working on the upper respiratory.
Sorry to
Yes, can you
interrupt.
hear me?
Let's say some noise in the speaker or the mic. If you could just hold the mic a little closer. You're talking from India too, so maybe the mic is a little bit far from your mouth.
Okay, okay. So the virus, when it is in the atmosphere and when it comes to contact with us, through the upper respiratory tract, that's via nasal tract, we have a lot of role in Siddha. So that we will discuss later. So according to the Chinese recent infection, the infection and severity, it was published in the journal by the Chinese doctors. All the patients never go to the critical stage. 80% of the patients will be in the mild stage, so they are very safe and nothing complications. Then only 5% of the people will go to the critical stage, and they are actually in the high risk patient. So there is nothing to panic actually when we talk about corona. In China also, again, they not only allopathy medicine, they also used traditional Chinese medicine combined with allopathy to fight against the corona. With this background, in India, we have Ayurveda and Siddha like traditional medicine. So we are now talking about the Siddha prevention. So I will tell people, ask the coronavirus is a new one, how your Siddha system knows about it, and on what basis you treat corona. So for that, in Siddha system, the whole human diseases are classified into 4,448 diseases. So even long ago, when HIV came, or dengue, chikungunya, when they came, based on the symptoms, we try to find out where the Siddha, which name is Siddha described for that disease, and we chose that drug. Same way, for example, here in the current scenario, the fever, actually in Siddha it is Suram. There are 64 types. For that we have two literature, Suranul, Kavya Suranul. In that, the one type is there, Khabachuram. So among 64 Khabachuram, that clinical features are matching with the corona. So with that aspect, under the Khabachuram, there are many medications mentioned. So we are actually prescribing those medicines for the corona infection. Then if the fever is uncontrolled, then it is actually called a Janni. Again, multi-organ failure, those things. Again, we have 13 subtypes. Similarly, upper respiratory nasal infection or sinusitis, these are actually 8 types. Respiratory system with other organ involvement, pharyngitis, laryngitis, low respiratory diseases. So like that, we have a lot of evidence to what to say that the system knows about the little bit about these, the pathology in our philosophical approach, with our basic approach. So come to the goals of Siddha in the COVID-19. So here we can help in the prevention of the corona and improving the host or human immunity, then reducing the severity of the patient. Suppose if we get infection, and we can keep the patient in the safer zone in the mild stage itself. And third objective may be the reversing the symptoms and countering the virus. So since it's a Kabam, it means we have a lot of list of herbals, dietary items. They are having anti-kapha, even tulsi, so turmeric, so many things. They are actually anti-kapha. So even our lifestyle, even hot water itself anti-kapha. So those things of lifestyle or food or herb we can choose to combat the virus. So here just I will have only one slide about from my side. So to us an anti-kapha, especially since the virus get into contact with us through the upper respiratory tract, especially through the nasal cavity, I will give some of the suggestion from Siddha side. So saline water, that's actually a normal saline, maybe 0.9%. If you
Sorry to interrupt a little bit. I think Dr. Kalyan is leaving to the hospital, so she wants to tell something about the medicine.
Sir, let him finish. It's good.
Is that sure?
Sure. Let him finish. Yes.
Okay.
Yes.
Right.
I'm listening. Yes.
Okay.
Okay, go ahead.
So the saline water gargling which also can be done as a nasal irrigation. So in the yoga practice, they use as a jalaneti. They pass through one nostril and take it out through the other nostril. That's called the nasal irrigation or jalaneti. So these two applications will definitely help you, and even because they alter the pH of the nasal cavity, so that it will make the unfavorable environment for the viral entry and multiplication. And the saline is also hypertonic, so they have a lot of other explained mechanism to reduce the viral population in the nasal cavity. The next aspect what we can do is steam inhalation. Even the same saline inhalation we can do, or nochi or Vitex nicono, this is called as nochi. With that herbal, again we can boil in the water, that can be taken as a steam inhalation. This again can sorry, not this is the mechanism. If it's a saline, it will reduce the viral population by hypertonic and altering pH in the lung. If it's a vital nicono, it has some other mechanisms to reduce to clear the lung secretion, so that it will clear the viral population. And next important thing is Eclipta alba. It's a karisalangani or karisalangani kire. There are two oils available in Siddha, like karisale madakutailam, and one more oil is Kayan Jailam. These both oil contain single herbal Eclipta alba with a different concentration. So usually we advise to apply this oil in the nasal cavity, 1 drop in each nostril after morning, after brushing, same way before bed. So, and also the same oil has to be applied in the throat area by using the our thumb. So that's another one. So this is called a valalai kalathidal. Valalai means khabam. So the kapha accumulation in the throat, that is called valalai. We have to daily remove it. So valalai kalathidal, so that we can improve the upper respiratory immunity through that. So this herbal is proven for a lot of activity like immunomodulatory, antioxidant, even preventing the release of inflammatory mediators. Even it reduces the viral load by some of RNA polymerase inhibition activity and all. Same drug is also given orally to prevent the pulmonary fibrosis, and this herbal is recently patented for this activity. So that is in the Siddha also it is mentioned, but some scientists worked on and prevent the it is patented. Even in the corona infection, this is one of the pathology, pulmonary fibrosis. So I suggest using this Eclipta alpha or Karisalangani in various ways can definitely help us from to fight against corona. Next advice is turmeric. So turmeric stick, if you dried turmeric, if you have that, after using these steps, and we have to make a smoke, and that we have to inhale through the nostril. So this will also believed to improve the immunity of the upper respiratory tract. So these are the few things I just suggest you, and we are also practicing and advising in Karnataka people, so that it will actually prevent the entry level. It will act only in the entry level and improve the immunity. For the next other suggestions, now Dr. Selva Shanmugam will be talking. So I will invite him to continue the talk with the aspect. After that, we can, I think, take the questions after his presentation.
Sure. So one thing I'll do is, like, as Dr. Kalyan has to go to the hospital, will Dr. Kalyan want to talk about some medicine questions, and then probably she will probably leave,
Yes.
And then Dr. Selva would.
Thank you very much, sir. Sorry for the interruption. I have to leave again, so that's why I want to make one comment. On purpose, I did not talk about treatment because I thought one, treatment is not standard of care, so we cannot recommend something that has not been tested in allopathic medicine. All we know is small studies, and we are doing it only to help people. This is not what we should be doing on a regular basis. That's point number one. Point number two, the hydroxychloroquine Zithromax combination should not be given to people who have only upper respiratory symptoms. I want to make this very clear. People think that if they pop a pill for any problem, they'll get better. That is not true, because this is a virus. Chloroquine or Zithromax has no antiviral properties. They have no ability to kill the virus. The only place we are using it is, like Dr. Arul pointed out, it's an immunomodulatory effect. So we need the immunomodulatory effect only when the infection gets to the lungs. So when someone becomes short of breath, even if it's mild, we don't mind giving the drug. But giving it just for a fever and a cough, it is not going to do anything. So let's save the drug for people who really need it and not use it for anybody who is COVID positive. That's one thing I really want to say. And like you mentioned, the combination of chloroquine and zithromax is going to cause prolonged QT. And in people who have heart problems, it's going to be a huge problem. And unfortunately, last week we did lose a patient. QT went to 550 and we couldn't bring her back. So things are, people just can't pop a pill and say, I'll get better. I really appreciate Dr. Arul's input. And I just want to say, even the Americans are now turning towards turmeric. They are using a lot of turmeric. I think they read from other sources and they are buying turmeric in different forms, pills, powder, and they started taking with water. And I think that news is out there in the public. And I think it's a good thing. And the last thing I want to mention is turmeric stick smoke. இது வந்து மஞ்ச பத்து சொல்றீங்களா நீங்க நம்ம ஊர் பாட்டில போடுவாங்க. Is that what you're talking about, Dr. Arul? Hello? Hello?
Hello, madam.
இந்த டர்மரிக் ஸ்டிக் ஸ்மோக் நீங்க சொல்றது அது மஞ்சள் பத்து அதான் சொல்றீங்க?
இல்ல மஞ்சள் பத்து இல்ல, மஞ்சள் குச்சி, மஞ்சள் ட்ரைடு மஞ்சள் குச்சி இருக்குல்ல மேடம், மஞ்சள் ஸ்டிக், அதை வந்து நெருப்புல காமிச்சு உடனடியாக அந்த தீயை அணைச்சிட்டோம்னா அதுல புகை வருது. அந்த ஸ்மோக்கை வந்து நம்ம இன்ஹேல் பண்றோம்.
I see.
This is only for the upper respiratory. நீங்க சொன்னீங்க rhinorrhea அல்லது upper respiratory irritation, அந்த ஸ்டேஜ்ல it will work. இது mentioned in Siddha literature.
ஓகே. அது இங்க கிடைக்கிறதா யுஎஸ்ல? Hello?
I think it's not there. Yes, it is available, the dried turmeric thing.
Okay.
In the Indian stores. And I think question for Dr. Kalyan was about the pregnant patients. They say, are the pregnant patients immune to are there any special category, or they have more immune to
They are definitely more immune. We are seeing, we did not see any pregnant patient and children up to age 5 get the disease. But in the last week, that statement is not true. We have seen a pregnant woman get the disease and also a newborn have COVID-19 positive. It's only 1 or 2 here and there. We have 2 cases in Michigan. So I don't know whether it is going to be a norm or this is just 1 or 2 here and there. We don't know. But the pregnant patient, as you very well know, we cannot use the hydroxychloroquine or the zithromax. So the new drug, the remdesivir, is being given to anybody who's pregnant or a newborn who has the disease. The company will release it for them for sure.
And there are many questions about turmeric, which I'll let Dr. Silva finish the talk and we can address that one specifically. Sure. And somebody again asked about the relapse rate after COVID, and I take it the understanding is we don't know. They asked, is it like chicken pox? Once you get it, you may not get it, but my understanding is that like we don't know yet, right?
I think it's going to be more like the flu and not like the chicken pox. You will get it every year, but once we have the vaccine and people take the vaccine, number 1, and number 2, if half the population get the disease in a mild form or severe form, we are going to have herd immunity. So once we have herd immunity, we'll all be much better. There will be still COVID, but it will not be as serious as this.
Perfect. So probably we can let you rest on. I'm sure you would have been very busy with all these things going on.
Yes.
And
yes.
I'll bring in Dr. Silva, and if any question comes in, then I'll kind of take it and post it at the end.
Sure.
Dr. Silva, are you online? I just unmuted you, so you should be.
Yes, I am on.
Okay, so what I'll do is I can stop sharing, and then you should be now, Dr. Silva.
Share the slides. Able to see the slides?
Yes, the slides started coming, and your video is not there.
Okay, able to see the slides?
Yes, the
Yes.
slides are there, but your face is, I think your camera may not be on.
Oh, okay. Yes. Okay.
Still, your camera is not on. Okay, we don't see your. Yes, you're on now.
Okay. Okay, thank you, Dr. Saravanan, for effectively moderate whole program. And good morning to members present in USA. And good evening to Sri Lanka, India, and Malaysia, Singapore. So I'm going to give some preventive care. எப்படி நம்ம வந்து தற்பாதுகாத்துக் கொள்றது அப்படிங்கிறத பற்றி தான் நம்ம இதில் ஃபோக்கஸ் பண்ணுறோம். So before going to the main presentation, I would like to share this slide. This is not a substitution for the current recommendations. Please follow the update recommendation recommended by the Center for Disease Control, WHO, and local authorities. So the second thing is, currently there is no scientific evidence to suggest that Siddha preparation and treatment methods can protect against COVID-19. The prevention methods described in this presentation are solely based on the previous proven antiviral properties of some Siddha formulation and other viral diseases. Some Siddha preparations, prepared Siddha medicines mentioned in this presentation are suggested simply like home remedies and preventive medicines by the Ministry of Ayush. There is Ayurveda, Yoga, Unani, Siddha, and Homeopathy. This is the Ministry of Ayush under the Government of India. The website is presented here, and anyone can search from this website. So what is preventive care? In Siddha system of medicine, the strength of Siddha system of medicine is preventive care. சித்தால பார்த்தீங்கன்னா காப்பு நீக்கம் நிறைப்பு அப்படின்னு 3 பார்ட் உண்டு. There is காப்பு means preventive and protection against any diseases. The second thing is நீக்கம். நீக்கம் means removal of the disease. The third one is the நிறைப்பு means restoration of the full health after any ailment. So in this presentation, we are focusing on the preventive care. So in this Siddha preventive methods, we are focusing more on lifestyle modification, diet management, and Siddha yoga method. So this type of Siddha preventive method is authenticated by the World Health Organization in a different word. It is called self-care. So what WHO is that definition of self-care. That is the ability of individuals, families, society to promote the health, to prevent the disease, to maintain the health, and to cope up with the illness and the disability with or without support of a modern physician or a healthcare provider. So this is the definition mentioned in the WHO, that is World Health Organization website. This is approved by the World Health Organization. That is the self-care. It is very, very important at this pandemic situation. So, according to the modern medical science, the various level of prevention are mentioned. In the prevention method, நம்மை தற்பாதுகாத்துக் கொள்ளக்கூடிய வழிமுறைகள் சித்தா இலக்கியங்களிலும் சொல்லப்பட்டிருக்கு. அதை கிட்டத்தட்ட மாடர்ன் மெடிசன், மாடர்ன் மெடிக்கல் சயின்ஸ் அதை வேற விதமா இப்ப சொல்றது. அதை பத்தி தான் நம்ம பார்க்க போறோம். The first one is primordial prevention. The primordial prevention means prevent the development of the risk factors. அந்த நோய் வருவதற்கு முன்பாகவே அந்த நோயை தடுத்துக் கொள்ளக்கூடிய வழிமுறைகளை பற்றி பேசுவதுதான் primordial prevention. So primordial prevention consists of actions and procedures that inhibits the appearance of the risk factors in the form of environmental, economic, social, behavioral conditions and cultural patterns of a particular society. It is called primordial prevention. இது நம்ம சித்த மருத்துவத்துல அடிப்படையாக இருக்கக்கூடிய பின்பற்றக்கூடிய ஒரு விஷயம். Primordial prevention அப்படிங்கிறது ரொம்ப ரொம்ப முக்கியம். It is the prevention of the risk factors in the current situation in countries or specific formulations or specific population groups in which they have not yet appeared. ஒரு நோய் வருவதற்கு முன்பாகவே, ரொம்ப காலத்திற்கு முன்பாகவே நாம் கடைபிடிக்கக்கூடிய வழிமுறைகள் மூலமாக நோயை தடுத்துக் கொள்ளக்கூடிய முறைகளை பின்பற்றக்கூடியதுதான் அந்த primordial prevention. At this junction, I would like to mention about that in the primordial prevention, the efforts are directed towards preventing children from adopting harmful lifestyles. இந்த இடத்துல நம்ம முக்கியமா சொல்ல வேண்டியது நெக்ஸ்ட் ஜெனரேஷனுக்கு இந்த primordial prevention கற்றுக் கொடுக்கிறது மிகப்பெரிய ஒரு முக்கியமான விஷயமா நான் பார்க்கிறேன். இதுல இந்த நெக்ஸ்ட் ஜெனரேஷன் இந்த primordial prevention பின்பற்றதுனால ஃபியூச்சர் ஜெனரேஷன், இன்னைக்கு நம்ம கொரோனா வந்திருக்கிறதுனால நம்ம உட்கார்ந்து பேசிட்டு இருக்கோம், பட் இன் ஃபியூச்சர் வேற டிசீசஸ் வரலாம். either it is communicable or non communicable, அதாவது தொற்று நோய்களாக இருந்தாலும் சரி, தொற்றாத நோய்களாக இருந்தாலும் சரி, we can prevent through the primordial prevention method. The next step is primary prevention. The primary prevention means manage the risk factors and prevent the onset of the disease. It is defined as the action taken prior to the onset of the disease, which removes the possibility that the disease will ever occur. In the primary prevention, two steps undu, rendu different stages undu. One is it consists of health promotion and safety through the specific protection methods. The health promotion அப்படிங்கிறது வந்து health education, nutritional interventions, lifestyle and behavioral modifications, இதெல்லாம் கலந்தது தான் health promotion. The second step is specific protection against the disease through இப்போ மாடர்ன் மெடிசன்ல எடுத்துட்டீங்கன்னா immunization and seroprophylaxis. இந்த ரெண்டும் வந்து specific protection against a particular disease through the modern medical science. சித்தால எப்படின்னா, in Siddha use specific nutrients or supplements in the form of food. This is the first step of specific protection. The second step is protection against environmental hazards. Third step is some safety or preventive drugs mentioned in the ancient Siddha literatures. So health promotion and specific protection are the two different forms of primary prevention. The third one is secondary prevention. The secondary prevention means the action that stops the development of a disease or early diagnosis, give the prompt treatment. The specific interventions are early diagnosis and the accurate treatment at the early stage. This is the secondary prevention. The secondary prevention includes protection of the family members and the society. The last one is the tertiary prevention that reduce the complication of the disability. It includes, or tertiary prevention means the methods of prevent or protect or reduce the risk of the complication and disability. This is called prevention, the level of prevention mentioned by the modern medical science. So what are all the primordial prevention mentioned in the ancient Siddha literature? First one is the very, very important, manage the sleep. So early morning waking up and early to go to the sleep. So adult require 7 to 9 hours of good sleep is required for fight against any disease, either it is communicable or non-communicable disease. So early waking up and early to bed is very, very essential. So the good sleep can fight against the anxiety in this current pandemic situation. The second one is early morning yoga and exercise. You know very well about the Padmasana and other asanas, fight against the infectious diseases. So next step is the reduce the stress level, relax the state of mind through yoga and some other practices. The next step is avoidance of toothpaste, soap and lotions and any chemical items. So come to this area. This is avoid chemical products. Avoid toothpaste, soap, lotions and use herbal powders at this junction. So toothpaste contain many chemicals. That is, many toothpaste contain flooded with many toxic materials like sodium lauryl sulfate, triclosan, carrageenan, fluoride. These toxic materials can enter through sublingual absorptions. It absorbs through the tongue and oral cavity and enters into the system, and it damages the immune status of particular individual. So try to avoid toothpaste. Instead of using toothpaste, you use herbal tooth powder. The simple herbal tooth powder is a combination of 3 powders. The first one is the Tribala-churnam, is very much available in all over the world. Tribala-churnam is the combination of 3 raw material. Kadukkai, Nellikkai, Tandrikkai. Tamil Tribala-churnam solvanga. So Tribala-churnam 100 gram, 5 gram of rambu. Rambu is clove powder, and 5 gram of salt, sea salt or alum powder. Alum padiharamnu Tamil solvom. So 100 gram Tribala-churnam, 5 gram rambu, 5 gram padiharam அல்லது 5 gram உப்பு. This is the very good combination of alternate to the toothpaste. So alternate to the soap is the combination of green gram powder and shade dried skin of the lemon. எலுமிச்சம் தோல், காஞ்ச எலுமிச்சம் தோலும் பாசிப்பயிறு மாவும் கலந்த கலவை சோப்புக்கு மாற்றாக நம்ம பயன்படுத்தலாம். நலுங்கு மாவு இன்னும் சில ப்ரிப்பரேஷன்ஸ் எல்லாம் ஏன்ஷியன் சித்தா லிட்டரேச்சர்ல மென்ஷன் பண்ணியிருக்காங்க. பட் நம்ம சிம்பிளா ப்ரிப்பேர் பண்றது, சிம்பிளா ரெடி பண்ணி வச்சுக்கிறது வந்து கடலை மாவு அல்லது பாசிப்பயிறு மாவு, அதோட ஒரு 10 கிராம் அளவுக்கு எலுமிச்சை தோலை காய வச்சு அதை பொடி பண்ணி இதில் சேர்த்து வச்சுக்கோம் அப்படின்னா இது வந்து சோப்புக்கு மாற்றாக நம்ம பயன்படுத்தக்கூடிய ஒரு பொருளாக இருக்கும். அதே மாதிரி ஷாம்புக்கு மாற்றாக சிகைக்காய். இந்த ஆல்டர்னேட்டிவ் soap, shampoo and toothpaste very essential at this junction. This is a part of primordial prevention. So on the early morning toothpaste அப்புறம் வந்து drinking of water is essential for preventing many diseases. So at this juncture I would like to mention நீராகாரம், whole rice fermented water. நீராகாரம், நெசி நீர், பழைய சோறு தண்ணீர் அப்படியெல்லாம் நம்ம தமிழ்ல சொல்லக்கூடியது. நம்ம ட்ரெடிஷ்னல் ரைஸ் குக் பண்ணிட்டு அதுல எக்ஸசிவா தண்ணி ஊற்றி ஓவர் நைட் வச்சிருந்தோம்னா மறுநாள் காலையில நமக்கு நீராகாரம் கிடைக்கும். ஸோ அந்த நீராகாரம் காலையில குடிக்கிறது, ஏர்லி மார்னிங் 5 o'clock 5:30 அதாவது பிஃபோர் சன்ரைஸ் குடிக்கிறது அவர் GI ட்ராக்டை வந்து ஸ்ட்ரெங்தன் பண்ணும். யூ ஆல் வெல் நோன் அபவுட் அவர் intestine is the second brain. Many microorganisms, that is friendly microorganisms present in our GI tract is nourished by Niraharam. So Niraharam contains some rare amino acids, some rare vitamins which doesn't present in the vegan diet, some trace elements, some trace metals present in that Niraharam is very vital for strengthening our innate resistance, innate immunity, as well as other strengthening the other organs present in our body. So நீராகாரம் காலையில குடிக்கிறது strengthen our whole system. ஆற்று நீர் வாதம் போக்கும், அருவி நீர் பித்தம் போக்கும், சோற்று நீர் மூன்றையும் போக்கும் அப்படின்னு சித்தர்கள் சொல்லியிருக்கிறாங்க. ஸோ நீராகாரம் குடிக்கிறது அட் திஸ் டைம், நம்ம வந்து இந்த டைம்லயாவது நம்ம நீராகாரம் குடிக்கிறத பழகிட்டோம் அப்படின்னா நம்ம by fight against communicable as well as the non-communicable disease against நம்ம உடம்பை பலப்படுத்துறதுக்கு உதவியாக இருக்கும். So try to avoid coffee, tea and other toxic drinks. Try to use neerakaram in the early morning. So next step is the healthy food. Avoid white sugar, table salt, and try to reduce the chili. Use palm jaggery, honey, fruit juice instead of using white sugar. Avoid table salt. Use that is sea salt and rock salt or pink salt, available, very much available in the US market. Use that instead of using table salt. You all well known about the table salt contain toxic material, especially a small amount of cyanide present in the table salt. It is very toxic to our immune status of our general system. It highly disturb our normal physiological function of our body. So try to reduce the chili powder. Use pepper, turmeric, garlic, ginger, dried ginger instead of using chili, red chili and green chili. So use kokum instead of using the normal tamarind. Kokum is nothing but Malabar tamarind. It is very much available in the US market. Use that tamarind, that is ancient tamarind, instead of using the modern life tamarind. இந்த புளியை மாத்திட்டு குடம் புளின்னு நம்ம பயன்படுத்திட்டு 200-300 வருஷத்துக்கு முன்னாடி நம்ம பயன்படுத்திட்டு இருந்தது. இன்னைக்கும் கேரளாவில் சில பகுதிகளில் பயன்படுத்திட்டு இருக்கக்கூடிய அந்த குடம்புளி. Botanical name is Garcinia cambogia. கோக்கம்னு நம்ம இந்தியன் கிராசரி ஸ்டோர்ஸ்ல போய் கேட்டீங்கன்னா கிடைக்கும். அதை வாங்கி புளிக்கு பதிலாக இந்த சமயத்தில் நம்ம பயன்படுத்த தொடங்கலாம். So at this junction you should avoid some modified or refined oils, modified milk, preservatives and fast food, refined flour, maida. We should avoid this type of items. The next step is the periodical bowel cleansing method. So one simple bowel cleansing method is combination of castor oil, ginger juice and honey. So the combination of castor oil, ginger juice and honey is effectively not only cleanse our bowel, it detox the whole system. So once in 4 months, you use this combination for effectively cleanse our bowel system and rejuvenate our entire body. So once in a week, oil bath is very essential, and once in 4 months, bowel cleansing is very essential to overcome this type of disorders. For a 5-year-old child, you use 1 teaspoon of castor oil, 1 teaspoon of ginger juice, and 1 teaspoon of honey is required for detox the whole system. For 8 years and above, 2 teaspoons each. That is 2 teaspoons of castor oil, 2 teaspoons of ginger juice, 2 teaspoons of honey is effectively cleanse your whole system. For 13 years and above, take 3 teaspoons each, and 18 years and above, 4 teaspoons each. Once in 4 months is required to rejuvenate the entire system. This is very good primordial preventive method mentioned in the ancient Siddha literature. So next one is the oil bath. So once a week is must. If you can able to take a oil bath twice a week, it is very good. So use at this junction, the tulasi is very much available all over the world, especially in the North America. So sesame oil 100 ml and 10 leaf of tulasi. Heat it, this combination, and use it as a herbal oil for oil bath. So the tulasi herbal oil is rejuvenate the entire system. So not only use in the head, use eye drops, nasal drops, ear drops, and all the 9 openings. Soak it with this tulasi sesame oil for at least 40 minutes. Allow it for 40 minutes and take a bath with hot water and a cigar oil. So next and last one is use everyday spices to avoid fast food. Take antioxidant food. It enhance the our total system. So here, natural immune boosters are mentioned in this slide. So you should prepare one spice powder. That is, வீட்லயே நம்ம வந்து அன்னப்பொடின்னு சொல்லிட்டு நம்ம சின்ன வயசுல கொஞ்சம் பாட்டிகள்லாம் செஞ்சு வச்சிருப்பாங்க. அன்னப்பொடி இதனுடைய தமிழ் நேம். இது ஸ்பைசி பவுடர் அப்படின்னு ஃபர்ஸ்ட்ல நம்ம மென்ஷன் பண்ணிருக்கிறேன். ஸோ கறிவேப்பிலை, ட்ரைட் ஜிஞ்சர், தைமால் சீட், ஓமம், பெருங்காயம், அசஃபோட்டிடா, cumin seed, பெப்பர் அண்ட் சோம்பு, பெருஞ்சீரகம், ஃபென்னல் சீட். இப்போ நம்ம இதை எல்லாமே ஈக்குவல் குவான்டிட்டி எடுத்து பவுடர் பண்ணி வச்சுக்கலாம். ஆர் கருவேப்பிலையை தவிர ஆல் த அதர் இன்கிரீடியன்ஸ், சுக்கு, மிளகு, ஓமம், சீரகம், பெருஞ்சீரகம் இதெல்லாத்தையும் பவுடர் பண்ணி ஒரு 100 கிராம் வருது அப்படின்னு 200 கிராம் கருவேப்பிலை வந்து சேர்த்து ஒரு பொடி மாதிரி ரெடி பண்ணி வச்சுக்கலாம். இந்த பொடி என்னெல்லாம் பண்ணலாம் அப்படின்னு சோறு பொங்கி சாப்பிடும்போது சாதத்தோட கலந்து பிசைஞ்சு நெய் அல்லது நல்லெண்ணெய் கலந்து சாப்பிடலாம், அல்லது வெந்நீரோட கலந்து சாப்பிடலாம், அல்லது மோரோட கலந்து சாப்பிடலாம், அல்லது சின்ன குழந்தைங்களுக்கு தேன்ல கலந்து கொடுக்கலாம். இது ஒரு நேச்சுரல் இம்யூன் பூஸ்டர். நெக்ஸ்ட் ஒன் இஸ் த ஜிஞ்சர் டீ. வேற ஒன்றும் இல்லை, நம்ம சுக்கு காஃபின்னு சொல்லுவோம் இல்லையா, சுக்கு வெந்நீர், அதுதான் இந்த காம்பினேஷன். இன்ஸ்டெட் ஆஃப் யூசிங் காஃபி அண்ட் டீ, யூ யூஸ் ஜிஞ்சர் டீ, ட்ரை ஜிஞ்சர் டீ. இதுல வந்து சுக்கு, மிளகு, சீரகம், தனியா இந்த நாலும் ஈக்குவல் பார்ட் எடுத்துக்கலாம். அதாவது ஒவ்வொன்றும் ஆஃப் டீஸ்பூன் மிக்ஸ் வித் 2 ஏலக்காய் போட்டுட்டு 1 கிராம்பு போட்டு நல்லா கொதிக்க வரணும்.
Dr. Selva, sorry to interrupt. A lot of questions about, because these are a lot of ingredients they're not able to follow. Maybe what we can do is, like at the end, we can give them how to prepare this or as a text message or doing the WhatsApp group.
Okay.
People are listening to it, and then there's so much information they need to take down.
Okay.
Probably what we can do is, like, once you're done with it, we'll tell the audience that we'll send probably a WhatsApp group message with this recipe specifically.
We can share the preparation at the end of the meeting. We can share it with our website or in the WhatsApp group in the preparation method, Dr. Saravanan. Any other suggestions?
The one thing was about the primordial prevention. The soap and things Dr. Selva was talking about was mainly for the preservers of long-term immunity. But for now, just follow the CDC recommendation on washing with soap and hand and everything. So those recommendations are currently for taking care of the acute situation and for these infections. What Dr. Selva was talking was about how you preserve and improve your immunity over years is by avoiding the use of chemicals. So that's one thing we want to clarify, that you still continue to follow the CDC's recommendation for hand washing and all the other disinfectants things they are recommending. Yes, so yeah.
Okay,
so you can start, and then it looks like a lot of questions about the preparation and everything. So once you're done with it, we'll probably come to that in a question and answer session.
Okay. These are all the simple preparations. The combination is very important. இதுல கலந்திருக்கிற பொருட்களை நீங்க வந்து குறிச்சு வச்சுக்கோங்க. நாங்க preparations வந்து at the end of the meeting we'll share it in the WhatsApp group or in our website. Dr. Saravanan and Sendamarai will share it after this meeting. Okay. So this is the ginger tea. This is very, very simple preparation, so coffee and so on. The next one is the Adimadaram tea. The Adimadaram tea is not only a natural immune booster, additionally it reduces the sleeplessness as well as the anxiety at this current pandemic situation. The combination is very simple. Adimadaram nama solluvom. This is very much available in the US market as the Yashti Madhu in Hindi, licorice in English. So you can buy it from the US market as a Yashti Madhu. So half teaspoon of Yashti Madhu mixed with kadukkai powder. There is haritaki, Tamil kadukkai, ஹரிடக்கின்னு இங்க யூஎஸ் மார்க்கெட்ல கிடைக்குது. இட்ஸ் அவைலபிள் ஆஸ் ஹரிடக்கி. half teaspoon of ஹரிடக்கி or கடுக்காய் powder, half teaspoon of எஸ்டிமது powder, dried ginger சுக்கு powder quarter teaspoon, pepper powder quarter teaspoon, and poppy seed kasagasa in Tamil quarter teaspoon. Mix with 200 ml of water, boil it and reduce to 150 ml. Filter the combination, filter the liquid and add adequate quantity of palm jaggery and drink it in a night. The preferred time is 7 p.m. to 8 p.m. You drink it and you have a sound sleep. It has the immune boosting effect, immunomodulating effect, as well as the anxiolytic effect, stress relieving effect, and it will enhance your sound sleep. It is very safe tea. It is very much available in the market. So to use this preparation. Adimadram has the many antiviral properties, and it is very useful. And the next one is the amla, நெல்லிக்காய் ஸ்வீட். நம்ம நெல்லிக்காய் வச்சு என்ன மாதிரி குழந்தைங்களுக்கு கொடுக்கலாம் அப்படிங்கிறதுக்காக இந்த ப்ரிப்பரேஷன் நாங்கள் சொல்லியிருக்கோம். ஸோ நெல்லிக்காய், ஜிஞ்சர். ஃபார் எக்ஸாம்பிள் ஒரு 50 கிராம் நெல்லிக்காய் எடுத்துக்கிட்டிங்கன்னா 10 கிராம் இஞ்சி. ஸோ 50 கிராம் நெல்லிக்காய், 10 கிராம் இஞ்சி, ஃப்ரெஷ் ஜிஞ்சர், அண்ட் பாம் ஜாகரி 50 கிராம்லேருந்து 100 கிராம் வரைக்கும் எடுத்துக்கலாம். யூ கேன் ஆட் ஹனி அண்ட் கீ. ஸோ நெல்லிக்காயையும் இஞ்சியும் நம்ம அரைச்சு, பாம் ஜாகரியை ஒரு தண்ணீரில் கரைச்சி ஒரு பாகு மாதிரி பண்ணிட்டு அதோட மிக்ஸ் பண்ணி ஒரு ஹல்வா பதம் வரும்போது தேன் ஊற்றி நல்லா கலந்துட்டு நெய்யையும் நம்ம ஆட் பண்ணிக்கிட்டோம்னா இது கூஸ்பெரி, அதாவது அம்லால் நெல்லிக்காய் லேகிய மாதிரி இருக்கும், ஒரு ஹல்வா மாதிரி இருக்கும். இது 1 டீஸ்பூன் இந்த மார்னிங் அண்ட் 1 டீஸ்பூன் இந்த ஈவினிங் நம்ம சாப்பிட்டு வந்தோம். நம்ம இம்யூன் லெவல் வந்து இம்ப்ரூவ் ஆகும், எஸ்பெஷலி இந்த யங்கர் சில்ட்ரன். ஸோ த காம்பினேஷன் இதுதான் நாங்கள் வந்து ப்ரிப்ரேஷன் பின்னாடி நாங்கள் ஷேர் பண்ணுறோம். அகைன் த சிம்பிள் ப்ரிப்ரேஷன் வித் அம்லா இஸ் அம்லா, garlic, pepper and buttermilk. So நெல்லிக்காய் பவுடர் ஆர் we can use நெல்லிக்காய் சின்ன சின்ன துண்டா வெட்டி கூட நம்ம யூஸ் பண்ணிக்கலாம். garlic, cut it in a small pieces. Pepper powder mixed with buttermilk, we can use it as a gooseberry salad. இது ஒரு தனியாக ஒரு 11 o'clock அந்த மாதிரி நம்ம தனியாகவே இது சாப்பிட்டோம்னா நம்ம இம்யூன் லெவல் வந்து இம்ப்ரூவ் ஆகிறது நம்ம வேற கண்டிஷன்ஸ்ல நம்ம பார்த்துருக்கோம். We can use it as this time for prevention of this pandemic situation. The next one is the herbal water. நம்ம கேரளால எல்லாம் இந்த தண்ணி கொடுப்பாங்க, ஜீரக தண்ணி. அந்த மாதிரியான ஒரு ப்ரிப்பரேஷன் the fight against some the current situation virus. So cumin seed, இப்போ இது வந்து 1 லிட்டருக்கு நான் சொல்றேன். For 1 liter cumin seed 1 teaspoon, half teaspoon pepper powder and half teaspoon omum powder, that is thymol seed powder. Mix it in 1 liter of water. Simply boil it and place it in your flask or your water bottle. So it is very effectively overcome the upper respiratory tract infection. It prevents the upper respiratory infections. It strengthens the respiratory system boosting effect, immunity boosting effect. The next one is the garlic honey. பூண்டு தேன்னு தமிழ்ல சொல்லுவோம். So garlic juice mixed with honey in equal quantity. For example, 50 ml of garlic juice mixed with 50 ml of honey. Mix it thoroughly, and 1 teaspoon in the early morning. Fight against many, not only in the viral infection, in this situation, many flu and the many conditions.
Dr. Selva?
Yes.
Yeah, the questions are very similar, like in the sense the preparations, it's hard to follow for them, so we can definitely give them we'll tell the benefits of these things now, but the ingredients and the preparation will specifically give them
Okay.
direction. So if you want to just kind of talk more on that overall condition and specific ingredients and preparations, we will send them, because I think they are not able to obviously follow up and write it down.
Okay, doctor. So you all well known about the effectiveness of the sunlight. So sunlight, 20 minutes in the morning, 20 minutes in the evening will improve your general immunity. You all well known about the vitamin D, the effectiveness of the vitamin D. It fights against many infectious diseases. So next one is the next primordial prevention is Vaspashana with Chinmutra. You all well known about the benefits of the asanas and the pranayama. So pranayama, Nadi Sutti pranayama is effective at this situation. So it expands the lungs and regulates the respiratory system. Intracellular respiration and cellular metabolic process will be enhanced through the pranayama. It reduces the brain wave frequency. It relaxes brain. So from beta type of brain wave frequency, cycles per second, to alpha type of brain wave frequency, it will enhance the relaxed state of mind. It will enhance your immune system. So next one is the increased absorption of oxygen, and it will ultimately help your immune system. It will control over the negative thoughts and reduce the risk of many diseases, and improves the concentration and the memory. It ultimately paves the way of peaceful mind and bliss. So Padmasana with Chinmutra is effectively overcome many diseases. So stillness of body will enhance the stillness of mind and ultimately give you the relaxed state of mind. So this is primary prevention. It has the three different stages. The first one is the lifestyle based. The first one is the steam inhalation. Covered by Dr. Arulamudan. That is the steam inhalation with the neem, turmeric, mint, tulasi, pepper, clove oil, nutmeg oil. You take any one of this preparation. நீங்கள் வேம்பு எடுத்துக்கலாம், மஞ்சள் எடுத்துக்கலாம், அல்லது புதினா இலை எடுத்துக்கலாம், அல்லது துளசி இலை எடுத்துக்கலாம். ஸ்டீம் இன்ஹலேஷன் ஒன்ஸ் இன் அ டே. இது வந்து பிரைமரி ப்ரிவென்ஷன்ல ரொம்ப முக்கியமானது, ஸ்டீம் இன்ஹலேஷன். அண்ட் த யோகா அண்ட் எக்ஸசைஸ், இதுல வந்து பாத்தீங்கன்னா நாடி சுத்தி பிராணாயாமா. The beginners வந்து start with the 6 units and morning and evening, increase up to 21 units morning and evening, effectively enhance your immune system and give you a relaxed state of mind, fight against communicable and non-communicable diseases at this stage. So at this stage, the comorbidity is very, very important for the prevention of for this at these conditions. Comorbidity is very, very essential. So overcoming the other comorbid conditions can be prevented by the yoga and exercises. Salt water or alum water is very, very effectively used at these conditions. The salt water is covered by Dr. Arul. Eye drops, use it as eye drops, nasal drops, and use it as a gargling. Salt water and alum water. The next one is the food-based method. We can use black gram instead of the உருட்டு பருப்புன்னு சொல்றதுக்கு பதிலாக black gram நம்ம யூஸ் பண்றது ரொம்ப யூஸ்ஃபுல். ஸோ இட்லி, தோசை இந்த மாதிரியான விஷயம் ப்ரிப்பேர் பண்ணும்போது வெள்ளை உளுந்து, தோல் நீக்கிய வெள்ளை உளுந்துக்கு பதிலாக கருப்பு உளுந்தை பயன்படுத்துறது ரொம்ப யூஸ்ஃபுல்லாக இருக்கும். ஸோ we can use it as a இட்லி, தோசை, கஞ்சி, கருப்பு உளுந்து கஞ்சி, porridge, களி, semi-solid sweets, and then green gram, sprouted green gram, as well as we can use green gram as a dosai, porridge, sweet laddu. And then sesame seed, you can use எள்ளு உருண்டை, sweet laddu, and எள்ளு சாதம் பண்ணுவோம் நம்ம வீட்டில எல்லாம். அதெல்லாம் இந்த டைம்ல நம்ம பண்றது அப்படிங்கிறது நம்மளுடைய ஸ்பெசிஃபிக் இம்யூனிட்டியை இன்க்ரீஸ் பண்றதுக்கு யூஸ்ஃபுல்லாக இருக்கும். அண்ட் எள்ளு சட்னி இஸ் ஆல்சோ வெரி useful combination for idli, dosa, and rice. So this one is the specific Siddha preparation mentioned in the slide. First one is the Amukara Churanam, Talisadi Churanam, Trifala Churanam, Nelika Leihim, Karisalai oil. There is two different type of Karisalai oil is available in the market. External use as well as the internal use. We can use internal usage of Karisalai oil. It is very useful for eye drops, ear drops, and nose drops. Please do not attempt to make this at home. Please buy it from this market. If you are any interested to buy this Siddha preparation, contact organizers, especially Sendamarai and other organizers. It is available in this your area. So next one is the treatment or eradication of the disease through some specific Siddha preparations. This is mentioned, that is mentioned by the central government Ayush Ministry. That is Nilavembu Kudinir, Kabasura Kudinir, Adavare Manapaku, Vishasura Kudinir. These are advised by the Department of Ministry of Ayush under the Government of India. So Nilavembu Kudinir is effective against many viral diseases like chikungunya, dengue, many positive results, many positive reports mentioned in the ancient literature, as well as in the our experience as very vast. So Nilavembu Kashayam 60 ml. That is 1 teaspoon of Nilavembu Kudinir Churnam mixed with 240 ml of water. Boil it and reduced to 60 ml twice a day for 14 days for prevention, mentioned by the advisory note of Department of Ayush. So the another one important thing is steam inhalation is also supplement to this Siddha preparations. So at the summary, we have to focus on the diet, lifestyle, and yogic practices is very, very essential for the whole wellness of our society. So wellness has the 6 dimensions: physical wellness, social wellness, intellectual wellness, spiritual wellness, and the occupational. Last one is the spiritual wellness. The occupational and emotional wellness are the fundamentals of 6 dimensions of wellness. Wellness is the way of healthy living. Must be observed throughout one's life. Buddha and other Indian system of medicines focuses on the healthy lifestyle and prevention of the disease. Stay healthy and stay positive and stay safe. If you have any questions related with the preventive methods of the system of medicines, I and Dr. Arul is ready to answer your questions. Thank you for listening to this primordial and secondary preventive methods mentioned in the ancient literature. Thank you, one and all. If you have any questions, please text Dr. Saravana.
Thanks, Dr. Silva. So I'll kind of open to questions, and I don't know how much to keep the timing to. Dr. Shankar, do you have anything else to add, or should we just open to questions? Let me unmute you too. So.
Thank you, Dr. Saravanan. I think in the interest of time, we should open the forum to questions. Thank you to all the speakers, Dr. Shamala, Dr. Arul, Dr. Selva, and for the great talk. And the physician, the Sri Lankan.
Dr. Sundaresh.
Sorry, I apologize, Dr. Sundareshan from Sri Lanka. It's a very great, very good talk from all of you, and we got data to be discussed in the physicians group because you had such excellent slides on treatment. So we will open the forum to questions and we will answer it.
Okay, so I think I'll keep the panelists unmuted. So some of the panelists are muted, just let me know on that WhatsApp link. Dr. Silva, based on your talk, I think obviously the soap thing we clarified that for now use all the CDC's recommendations. That's one thing. And the question about the Niragaram, people asked whether any age can take, and are there any restrictions on health conditions that they should or should not take the Niragaram?
Please repeat the questions.
So with the Niragaram, can anyone take, or if somebody has some health issues, can they still take it? Like, are there any reasons or contraindications for Niragaram?
No, there is no contraindications in taking Niragaram. It is not only, or it's not a treatment method, it's a part of our food habit. So Niragaram is prepared from our traditional rice. It is very, very important. So it is not used for prevention of disease. It's a part of our food. But it has some amino acids, vitamins, trace elements. They enhance our entire system to fight against any diseases, especially in the communicable diseases. So it is no contraindications mentioned in the ancient literature as well as reported in the modern research reports.
And Divya asked specifically, any specific home remedy to improve immunity in this situation for pregnant ladies and new moms?
Pregnant ladies.
Yes, and new mothers, like pregnant ladies and somebody who had a baby recently. Are there any specific preparations, or is the same preparation applicable to them also?
So all the preparations mentioned here are the same for the pregnant women also. In additional to this preparation, there is one additional preparation is Madulai Manapapu or Madulanga Rasayanam is available in the US market. So 2 teaspoons of Madulanga Rasayanam or Madulai Manapapu in the morning, afternoon and night. It's a very simple Madulai charu. There is pomegranate juice, palm jaggery, honey and paneer, the rose water and so on. Yeah, and the combination of the Madulai Manapapu. Or you can use Madulai, soak it in honey. It is very additional boost your immune system, especially in the pregnant women.
And Ananda Kumar asked whether you can demonstrate the Nadi Sutti Pranayama once.
Okay. So Nadi Sutti Pranayama is the various methods mentioned by the various yogi practitioners or yogis. We educate our patients at the simple preparations. That is, close the right nostril, inhale the inhalation through the left nostril, roughly 8 seconds, close the left nostril and open the right nose, exhalation with the 16 seconds. And again, inhalation through the right nostril, 8 seconds, close the right nostril, and exhalation through the left nostril. It has the 6 steps. Inhalation through the left nostril, 8 seconds. Kumbhaka, that is control, that is ulla nama adakki vechirukiradhu. Other 1 second, 1 or 2 seconds. Exhalation through the right nostril, 16 seconds. And again, inhalation through the right nostril, 8 seconds. Exhalation through the left nostril. This 6 steps contains the Nadi Sutti Pranayama. In the RO சேர்ந்தது ஒரு unit. So start with the 6 units twice a day. Gradually increase up to 21 units in the morning, 21 units in the night. This is very simple yogic Nadi Sutti Pranayama. Another one simple method is in the Chin Mudra, inhale the air through both nostrils, exhalation through the thumb sound. This is with the closed eyes. Inhalation through the both nostrils, exhalation with the thumb sound. This is another method. So both are very useful at this juncture.
And they also want the mudra, the Chin Mudra to be showed.
Chin Mudra?
To show the Chin Mudra.
This is a simple method. This is...
Move your hand a little bit to the center, Dr. Selva, I think, to the center of the screen. Yeah.
Okay. All are able to see the Chin Mudra?
Yes.
So index finger touches the thumb. All the three fingers are under. This is Chin Mudra. This is also called Yoga Mudra. The another one method is Purna Yoga Mudra is place it 2 fingers on the left side of the chest wall. This is Purna Yoga Mudra. This is also very useful. 5 minutes with the closed eyes with normal breathing mudra. This is Purna Yoga Mudra. This is also helpful at this time.
And the Niragaram, the 2 questions. If you have a cold and a cough, can you still take the Niragaram? And if you're a diabetic, can you still take Niragaram?
Yes, we can advise to take Niragaram for the diabetic patients, hypertension patients, cardiac patients. It's very safe. If you have any doubt, take along with pepper powder or dried ginger powder or turmeric powder. In the case of chest cold or nose cold conditions.
And there are a lot of things about where to get the preparations and everything. We'll come to that. And how to prepare Niragaram. Those things, I think, much better to be sent as a in the website itself. So I'm not going to take those questions at this time.
Okay.
And somebody said, like, behind Nilavembu packet says it should not be taken unless necessary. So what is necessary is their question about Nilavembu.
Okay, I would like to say something about the Nilavembu decoction at this juncture. The Nilavembu decoction is a very safe in our experience. So you can take Nilavembu decoction. That is, the preparation is very simple. 1 teaspoon of Nilavembu powder mixed with 240 ml of water. Boil it and reduce to 60 ml. Take twice a day for the prevention. So at least twice a week is essential to prevent this type of pandemic conditions. It is very safe. But one thing is the manufacturing company is very, very important. There is ISO certified company you should buy from this market. MCOPS, SKM, and some other preparation are very authentic preparations are available in the market. One should ensure the prepared company. ISO certification is very important.
Okay, so just looking at some of the things. Somebody asked about the preparation of Kabasuriya Kashayam in US.
So it is Kabasura Kashayam is a traditional preparation mentioned in the ancient Siddha literature. It is available in the market. It contains some rare herbs. So it is better buy from the market.
And somebody about they asked about the traditional rices. Can you tell the name of a traditional rices? Again, we can put all the names there, but if you have something to say to them about traditional rices, what people can get now, maybe you can tell about few traditional rices that are available.
ட்ரெடிஷ்னல் ரைசஸ் வந்து ஒரு 300 டைப்ஸ் ஆஃப் ட்ரெடிஷ்னல் ரைசஸ் இருக்குது. இப்போ வந்து யூஎஸ் மார்க்கெட்ல வந்து காட்டி ஆணம் அப்படிங்கிறது கிடைக்குது. கருங்குருவை மெனி இந்தியன் கிராசரிஸ்ல கிடைக்குது. ஸோ கருப்பு கவுனி அது கிடைக்குது. அதுக்கப்புறமா பார்த்தீங்கன்னா மணிச்சம்பா, சீரக சம்பா, மாப்பிள்ளை சம்பா. அதுக்கப்புறம் பார்த்தீங்கன்னா கேரளா மட்டா ரைஸ். திஸ் இஸ் ஹேண்ட் பவுண்டட் ரைஸ், அதாவது கைக்குத்தல் புழுங்கல் அரிசின்னு சொல்லுவாங்க. ஹேண்ட் பவுண்டட் பாயில்டு ரைஸ். இதெல்லாம் இப்போ வந்து ட்ரெடிஷ்னல் ரைஸ் வந்து அவைலபிளாக இருக்கு. இது நீங்கள் யூஸ் பண்ணிக்கலாம். இட்ஸ் அவைலபிள் இன் ஆல் ஓவர் த வேர்ல்ட், எஸ்பெஷலி இன் இந்தியன் கிராசரிஸ்.
And that's Dr. Selva Kumar Mani in the audience. I think he's also a Siddha doctor. He kind of said, also reiterate saying that that Nilavembu is a combination of herbals. So it's not just one product alone. So it's a combination of herbals. And like Dr. Selva said, there are many companies that may be different and everything. So I think that's where you should probably discuss with somebody who has the knowledge about this individually before you really take it, and at least get some idea about it rather than just going with your own instinct and everything. Because like Dr. Selva said, the companies may be different, the combination and preparations may be different. And that's what Dr. Selva Kumar Mani from one of the participants wants to kind of reiterate on that one. And somebody asked about the Nellikai legium. It should take, as per the bottle, it says it should be taken after food, but doctor said differently. Ananta Kumar has the question.
So, Nellikai legium, the ideal time is 20 minutes before food. So, many of the Siddha preparations are effective in the empty stomach. So, you take Nellikai legium before food is effective, or you can take after 1 hour of food.
Again, the same thing on the respiratory issues. People, can they take fermented rice? Again, they're talking about the niragaram, I believe, and I think they can take it as your recommendation, right?
Yes. So in these conditions, I would say the niragaram, there is 1 tumbler, 200 ml of niragaram, mixed with 1 teaspoon of ginger juice or dried ginger powder or pepper powder or turmeric powder. You can mix this with ginger juice, niragaram. Or you can add onion, small onion, shallots. Cut it, the small onion, and mix it with niragaram and drink with adequate quantity of pepper powder in the early morning.
Dr. Saravanan, I want to make a comment. This is Dr. Shankari.
Sure.
I think, in what I would like to reinforce what Dr. Selva Shanmugam mentioned is that we don't want to suddenly you introduce all preparations at one time, because that's not the treatment for COVID, right? I think some people's body, we are used to taking all these on a regular basis, but sometimes when we are not used to taking it, introduce it slowly and see how your body reacts. So I just want to reassure people that we cannot suddenly introduce every ingredient at one time. We have to introduce one at a time and see how your body can adjust to it if you are not used to taking it on a regular basis. So especially some people have GI problems, then pepper might upset them. So everything, use it, introduce and listen to your body, and it will give you the answers what you can digest, and that's what I would caution everyone. Thank you.
Thank you, Dr.
That's a good thing on it. And Dr. Selva Kumar Mani from the participant also said, like, depends on the climate part of it. Like in India and here it's different. It's a cold season here, warm season there, season changes. So there are individual things people have to look at too. I think there's one other thing you could think about is like definitely talk to somebody or even consult with somebody on your specific thing. Dr. Selva will agree that everybody is different. And something that's very applicable to one person may not be completely applicable to others. So it's a good way to talk with somebody who has a knowledge of the system and get a personal recommendation for you too.
Okay, I mentioned here, all the slides mentioned here is applicable to all the types of seasons, all the type of body constitutions. We can use this preparations. This the preparation mentioned here and the advices mentioned here is applicable to all the seasons, all the body constitutions. It is not specifically advised to specific body constitutions. It's a common thing.
And if people have any specific questions about their condition, it's much better to talk with somebody that
Yes.
has that knowledge and go from there. I think most of them are talking about where to get these kind of ingredients. I think it's a little difficult from us to say, and maybe the website can give some recommendations or things, but it's hard for us to say where exactly to get these things, but most of them are common ingredients. So I think probably I'm just going through the questions to see, is there anything? Somebody asked about, is Kerala rice good compared to the other rice that's available here? Is it better?
I think all the ingredients are available in the US market. Based on the availability only, I put the slides. So if you have any doubt, please write it in the WhatsApp group or in the email ID mentioned in your meeting notice.
And someone asked about toddlers. From the kids and toddlers, is there any big difference in these recipes when you give to the small?
Reduce the dose. It's a small kit cans. Above 5, it is safe. Above 5 years, it's safe. The dosage, you can reduce the dosage. For 5 years and above, you use the quarter dosage. And 8 years and above, half. 13 years and above, 3/4. 18 years and above, the full adult dose.
Okay, so what I'm going to do is I'm going to bring Tamari back here so that we can kind of give a wrap up and then see how we can follow up on these things. Let me thank the panels first, and then let me find Tamari and unmute her.
Sorry, Dr. Savana, I didn't hear the. It's a question to me.
No, Dr. Selva.
No, Dr. Selva.
Yes.
It's not a question. I think Tamari is going to come back and kind of give a summary.
Okay.
Okay. Tamari, are you on?
I don't think she's on, Dr. Saravanan. We cannot hear her.
Dr. Saravanan, you can also summarize the whole thing to the participants.
So I think she's back on here, right?
The red lotus is, I see her.
Yes.
Oh, she's still on mute, Dr. Saravanan.
I don't know, she go back. I think I unmuted her and
okay.
Goes back on the mute again. But if not, I think I can definitely summarize quickly. I think it's great for us to have Dr. Selva and everybody here, and Tamari can kind of, if she's available, can give a quick summary. But what we'll do is post this in our website, the slides, and so that the preparations and everything will be there. If you have any specific questions, you can definitely communicate in that WhatsApp group. And again, as we said, and Dr. Shankar rightly pointed out, this is a very process that you need to follow over time. It's not just one quick fix here, but definitely you can make some changes. First thing is what I've done is avoiding certain stuff. That's the first thing you can do. Then adding the good stuff slowly. And if you have any specific condition, there's always help available. Like you have the doctors available here. These doctors are also available. You can communicate with them directly. They're available with WhatsApp or appointments or telephone calls and everything. And you can tell your specific condition, they can discuss with you. So just take this as general recommendation as a lifestyle changes, and every simple and single thing matters. So go slow and steady and change your lifestyle and improve your immunity. For now, the best defense we have for these things is making our body fight against this rather than just waiting for somebody to find something. It's good if they find a medicine tomorrow or a vaccine tomorrow, but it may be something else next year. So it's much better to get yourself prepared. And that's what the combination of what we call an integrative medicine, the modern medicine and the traditional medicine can give us the strength to get the best from the both worlds. So the other thing is, I think if you go to the website, we'll have information about the organization itself and what it's trying to do and how we are trying to get some support and funds and everything. So if you could just support in any way, that's great. If not, just keep engaged and we'll get the speakers coming in often and give an update.
Dr. Saravanan, this is Sivasalam. Let me, I don't know whether Tamare can talk, but if the others can hear me, we need number of volunteers, people who are like very good with IT support and other areas. If they can email to gcsmr20@gmail.com, we'll get in touch with them and use their help. And also, I wanted to emphasize, I mean, we have signed a MOU with Manipal University, and then we are trying to build up the center, as Dr. Arulamudan mentioned. So we'll be getting in touch with people who can help us in that regard too. I also want to thank all the speakers in spite of their busy schedule to join us at different time periods, like people in India, especially each night, and also with the Dr. Kalyan. I mean, her speech and her experience was really excellent. And then Dr. Selva Shanmugam, Dr. Arulamudan, and Dr. Sundaresan from Sri Lanka. Thank you very much for all your and filling us up with the lay persons like us, and Dr. Saravanan for really moderating the session. I mean, we went through some hijacking, but we were able to pull through and come back and finish the session. And then I think we will be hosting these kind of talks periodically. We will get back to you once we, as a group, discuss and decide when we want to hold the next session, but it'll be pretty soon. If not, at least by the middle of April, I think we will try to have a session. With that, I want to thank everybody again. If you want to help us, please email or text us, and we will get in touch with you. The needs are many, and then
Hello.
yeah, go ahead, Tamare, please wrap up.
And no. If it's Shana, I'll join you later. Are you done?
No, I'm Ron. I'm done. Yeah.
Okay. Yeah, we'll wrap it up. Thank you all for joining today. As we discussed so many things. We had one meeting. We had a lot of slides, and we were going into the scientific detail. But this time, we asked Dr. Selva and Dr. Arul to go back to the layman and explain what we needed and what we should do. So that's thanks to Dr. Shamla Kalyan for her wonderful speech, and Dr. Sundaresan from Sri Lanka. We thank all the doctors for their speech. We will be having the meeting every month from GCSMR. So stay tuned. I know most of you want a lot of information about preparation. We want to skip that because it's we have to go in, so we don't have time for that. And you know, this preparation and all those things, or there is some specific details to it. Better to have that posted in our website and on our WhatsApp groups. Whatever Dr. Selva told, that is some of the things that are common and it's generally for to boost our immunity. As you all know, Dr. Selva here and also in India, Chennai. When he visited, he has been going around for a lot of places here. So for certain extent, he know what are the available. Trying to say that you have a specific need or specific medical condition or health condition, it's better to discuss with your physician or Selva to go into the detail. As we already told, a treatment plan or 100% treatment for COVID virus or anything. This is just for us to how to not panic and stay calm. How we should have to face this a pandemic at this time. Of course, we had this hacking situation that's been going on for a while for everyone who is using the Zoom. We have strong, stay with a positive note, and we will fight as we fought other viruses. So follow your CDC guidelines, stay home safe. We will be posting more information about and all other that we can't discuss today. Stay tuned. Whatever your questions are, please put it in the WhatsApp group. We have also formed another Telegram group because we will be exceeding the WhatsApp group limit. So we'll be um, Telegram group. Please join that too. We will be informing on all groups going on when is the GCSMR conference call. Not only about this COVID virus, we'll be doing every month in each topic as a president of doctors. And again, my name is Mrs. Sendamari Prabhakar. I am secretary to GCSMR. Thiru Sivasailam is the president, and we have Balan, and we have also board of directors, Dr. Saravanan Kupsami, Dr. Ravi Palaniappan, Shankar, and we have all others too. We have GCSMR registered as non-profit also, and Dr. Arulamudan in Manipal University, who's taking care of that Manipal University the center there. He's working on it. With work, we sign up MOU with Manipal University. We stay tuned for more information. We need all your support and volunteers. Thank you for now. Bye.